Okay, I think, well, some people are still, are you okay?
I forgot to give me a lens of the camera.
Yeah, you have time to, Okay, I would like to get started so we can use our time. I know people are still getting food, we have new plates, and some people come in, but to use our time well, I'd like to start. My name is Tosca Bruno van Vijveken. There are some new faces here. I co-direct together with Hans-Peter Schmitz, who sits over there.
That percentage, I think.
And the Transnational NGO Initiative here in the Moynihan Institute of Global Affairs. And we focus, in case you don't know, on the governance, leadership and effectiveness of transnationally operating NGOs as they perform their role in global governance. So today's talk, which I'll introduce in a moment, is going to focus a lot on governance and governance reform, organizational change around governance reform. But before we do it, because it's our first talk of the semester and of the year, academic year, I wanted to also bring a couple of people, draw your attention to a couple of people who you can approach if you have questions about the TNGO initiative. There's Carlo here. Carlo, you want to stick up your hand or stand up?
Oh,
Carlo is one of our graduate assistants this year, and Mark Mason, who just ran out because something about the camera is missing, so he needs to go back to ICT. But Carlo and Mark are GAs. We also have an extensive volunteer student team who I'm very proud of as well. Julia is one of our volunteer students, and who else? Anybody else who I'm missing?
That's it.
That's it, right, for now.
We're in DC this week.
A couple of them are in DC this week. So if there is a sign-up list going around, if you do not yet receive, if you're not on our listserv, then please put your name on here. We also have our website with an RSS feed for all our updates on activities, new publications, commentary on what's happening in the sector, etc. Please, we encourage you to sign up. And I wanted to ask Hans to talk about one of the upcoming talks, and then Carla will talk about another one.
On November 1 is the Public Diplomacy Forum. Is everyone aware of that?
Yep.
John Prendergast is the main speaker, and there's also a panel that I'm leading on coalitions, NGOs and coalitions and how they build coalitions. But there are also other ones. Someone else can talk about it more. Sorry. And on November 6th we have a speaker. Yeah, maybe you can explain a little bit more. And then on November 6th, we have Shana Plout, who will talk about Romani and indigenous human rights activism and journalism.
So
what's the intersection between journalism and human rights activism?
That nexus indeed.
So if you have any questions about those events, please.
And then Carlo is.
Yeah, so November 7th, we'll have another event, which is a student-led panel. Some people here are actually going to participate in it. We'll talk about collaboration and management issues between expatriates working in different countries with transnational NGOs. And it'll be at 12:30 November 7th, which is Thursday.
So this is students speaking from their own experience about the tricky issues between expatriates and national staff, which is
Good topic.
an interesting and hot topic. Yes. So we hope we will see you at as many of those events as possible. All right, so now I'd like to introduce our speaker and visitor for today, one of our practitioner visitors this year, Kris Torgenson. She is the former Secretary General of Médecins Sans Frontières, which you may also know as Doctors Without Borders. So she was the superhead of the global organization of Doctors Without Borders until last September, so about a year ago. Doctors Without Borders, as you probably know, is one of the world's most renowned humanitarian relief and emergency assistance health-focused NGOs in the world. Typically performs their role in emergency relief immediately following disasters and other forms of crisis. Often is known as being first on the scene, or amongst those who are first on the scene. Kris started working in MSF in 1998. Was the Director of Communications for MSF USA before she joined MSF International. Interestingly enough, she holds a bachelor's degree and most of the master's as well as most of PhD work towards Chinese literature and language at Columbia. Was at Wesleyan before that. And currently, since September of last year, when she left MSF, she is working as a nonprofit consultant for a couple of internationally oriented public health, mostly public
Primarily,
health
yeah.
organizations. Kris, by the way, just to advertise that too, will also do a more informal career discussion with those of you who are interested in a career in the humanitarian emergency sector or development as a broader sector and NGOs this afternoon from 4 to 5 in 204B. Am I right? Yeah. Maxwell. So hope to see some of you then. We will also be recording 2 short interviews with Kris this afternoon before she leaves, and those will be on our website from next week onwards. So if you sign up to our RSS feed, you'll know immediately when they come up.
Great.
Over to you.
Well, thank you all for, thank you very much for Tosca and Hans for inviting me here today, and for, I think Mark helped to arrange the events, and I appreciate that very much. It was a great opportunity to get to know the Transnational NGO Initiative and the work that it's doing. We've had a nice chat a little bit already, and I hope it will be an opportunity for an ongoing relationship. And thanks for coming, and I hope the lunch is good as well. As Tosca mentioned, from 2008 until 2012 last year, I was Secretary General of Médecins Sans Frontières, better known as Doctors Without Borders here in the U.S., but I'll refer to as MSF. I think many of you are familiar with NGO, so you'll hear internally, it's only called MSF, never anything else. So, and previous to that, I was working in communications and helped build the U.S. office of MSF over a 10-year period, so can also speak to that. One of the tasks that I was charged with as Secretary General was what we called the governance reform process. Not a very sexy name. We tried to come up with lots of interesting names for it, GORP and Odyssey and all kinds of branding. None of it worked. It just became governance reform. So it's by far not the most interesting part of MSF's work. But I assume some of you are somewhat familiar with the field work that MSF does. But I will go over that for a moment just so that you have some background. And then talk a little bit about what prompted the need for reform, the process that we took, the results, and maybe a few words on lessons learned and some of the elements that I felt were key for leading a reform of a large international organization like MSF. So I hope that's what you came for versus a real field-oriented discussion. So here's what I'll talk about today. But it is always good to start with the bread and butter of what MSF's work is, which, as Tosca mentioned, is medical humanitarian action. The organization was first founded in 1971 in the wake of the Biafran crisis in Nigeria. It was founded by a group of French physicians and journalists, an interesting marriage, who were quite frustrated with the actions in the crisis and wanted the opportunity to be able to speak out very strongly on what was happening there. So you can see the 10, 12 French guys sitting around the table smoking a lot, founding the organization back in 1971. It's the only picture we have, and we all laugh about it, so we put it on everything. A few of them are still around. They're called dinosaurs in MSF parlance. I'm also one, and I'm only 14 years, so there you go. So one of the reasons why they founded the organization was because they wanted to affirm some very concrete principles as far as that defines humanitarian action and the action of MSF. And so these were put into a charter for the organization, which remains the charter for MSF to this day. It's really sacred in the organization, even if the English is quite bad in the actual document. We keep it because it really enshrines those core principles, which I want to talk about for a moment because they also infused the governance reform process in some ways. You wouldn't think about it, but it does. And so the 3 core principles really being neutrality and impartiality of action, and independence from all economic or religious or other powers. And that the aim of the organization is to provide assistance to populations in distress and to abide by medical ethics, and to have a basis in volunteerism, that people are joining MSF and crossing borders to provide assistance, even if they get paid a stipend, et cetera. But that notion, it's a very French notion also, of volunteerism and going to help others across borders is core. So all of these are still very important. Neutrality, impartiality, being able to work on both sides of a conflict, not being seen as taking any one side or being more present on one than the other. It remains to this day incredibly important. Working independently, not being seen as an arm to any government or any political party or aim is incredibly important also. And we can talk about that a little bit on how that allows MSF to get access in most places to populations on both sides of a conflict. The MSF around the world, I won't go into detail on this, but Tosca mentioned the emergency work, but actually MSF is really grown over the years and does a great deal more than just what you see on the news very often, which is the high-profile emergencies that many of the organizations flock to. MSF now has programs in around, it changes constantly as we open and close countries and programs or get kicked out of a country or leave. In about 70 countries. There are about 32,000 positions in the field. People are very familiar with seeing all of the European doctors and nurses that are very much the emblems of MSF, but in fact they only make up about 9% of the issue we're talking about, expatriates in the field only make up about 9% of the total staff of MSF. By far the larger, 8%, by far the largest are national staff. You can talk all of the numbers of the consultations, et cetera. One thing that the organization also prides itself on independence, but is also not very well known, which makes it quite distinct from many of the large humanitarian organizations that you may also know of, like CARE and Save the Children and so forth, is that MSF takes very, very little government funding. And we take absolutely no US government funding for the last, 10, 12 years, and takes very little other institutional funding as well. So institutional funding makes up about 9% of close to $1.2 billion organization at this point. And we have something like 4.6 individual donors around the world who provide the real substance of the unrestricted funds that make MSF able to be as independent and also as responsive as it is. And this is something to think about, I think, in your studies as well, is that when you have that ability to go where you think you need to go and do independent assessments without having to ask others for funds or go where they want you to go, it makes a big difference in your responsiveness to a crisis. So, and this is again core to how the organization wanted to maintain in changing its governance. This is U.S. funding, which could be. So expenditures, always something for those of you who look at things like the charity watchdogs. We spend about 81% globally on funds. Fundraising is typically a bit higher percentage in MSF because building up individual donors and maintaining those donors actually costs more than getting government grants, and that makes a big difference. Sometimes when you see organizations that say they send 99% of their funds to the fields, you can question it a bit sometimes. So, and we actually have international combined accounts, so all of the accounts across the entire organization are combined in a one-year process every year and audited independently, which is something that took many years to put together. So we work in armed conflict, work in malnutrition. I'm just going to go through quickly because I think it just gives you a sense of the scope. Epidemics, so many times it can be a fast epidemic, but it can also be the HIV pandemic, which is something which means that we have programs that last for many, many years. Tuberculosis. We have programs, we might have been there for something else, but we ended up staying much, much longer for longer-term programs. Natural disasters, these are often the poster child kind of responses that you see because they're on the news so much, but they actually make up probably, I think it's about 7% of activities. It changes year to year if you have a big crisis like the Haiti earthquake or something. And we also have quite a few programs in exclusion from healthcare. So, for example, you mentioned the Roma. Somebody's going to be speaking about that, and certain population groups, even in affluent countries, who are marginalized and don't have adequate access to medical assistance. And we have, the organization does many types of interventions, from primary health centers to mental health work to water and sanitation. Also is very well known for the logistical capacities to be able to get into a place with the materials needed, and has spent years developing kits and guidelines that are not only used by MSF but are used by many organizations, and have been also very influential on policy and procedures for the World Health Organization and globally. Another initiative that MSF prides itself on is speaking out and bearing witness when they feel that there is a situation where either humanitarian aid is being manipulated or there is not adequate access to assistance for a certain group or population. And one of the big campaigns that probably many of you might not necessarily associate MSF on, but you've probably worked on, has been on the access to essential medicines issue of lobbying for reduced prices, first for HIV medicines, but then for many other medicines, and access to care in the developing world. So I won't go through this. I'm going to go to sort of the less fun part, but hopefully you'll have some questions to ask about this. So basically, in 2008, when I started, there was a lot of questions being raised around the organization, and I'm going to go into the reasons for this, about the need to revise the structures of the organization to better fit with the external and internal challenges the organization was facing at that time. So I'm going to go into this why reform. Well, here is the old structure of the organization. Basically, it had started in France, as I said, in 1971, but then had branched off into having 5 operational sections. I'm going to keep it very simple because it can get very complicated, but having 5 operational sections, all based in Europe, primarily MSF, what we call MSF France. It's now called Operational Center Paris. We've changed the names as well. So, but still Paris, Amsterdam, Brussels, Geneva, and Barcelona. So 5 operational centers, all based in Europe. They had, through sometimes with agreements, had started up, but there had actually been a moratorium on any new operational centers, and that was put in place about 15 years ago. I'm saying, okay, 5 is enough. We can't have everybody becoming an operational, and that means a center that actually sends out the medical teams, has operations in a given situation, et cetera. But we do need to have recruits, we do need to have financial support, et cetera. So we'll have offices that we will call partner sections or support offices that will help raise funds, carry out advocacy, and support the operations in some way. So the US office was founded, the Japanese office, the Austrian office, a bunch of offices, 14 of them, primarily all in the north, up until very recently. Mainly in Europe, then with Canada and the US, and then Japan and Hong Kong and Sydney in Australia. These are clustered around an operational center to help provide the financial support to them, et cetera. So I don't want to go too into this, but basically what had happened, and I'll come back to this, is that we had put together a silo organization where you had 5 operational centers. Each of them had an independent governance structure, and each of them had different means of gaining funds, and each of them could also send field operations to any country where they felt there was a need. And so you have a situation where you have many countries where you'd have 5 operational sections on the ground with independent offices, independent structures, independent logistics, et cetera. You can probably guess where I'm going with this. And then you also have conflicts even between MSFs who are working in the same place, et cetera. And you had and this was by choice, a very, very basic international coordination at the top level, where you had the 5 OCs, each with their own board. You had all 19 sections, each with their own independent board. And then you had each of the 19 presidents of those sections being able to go twice a year to an international council to make decisions at an international level. So you could see that very few decisions were actually made at an international level, and even some of those that were made were really not adhered to very well. So even that decision that they made at an international level 15 years before to not have new operational centers or new offices was not really adhered to, and a number of other entities had sprung up around. So this is the growth of the organization, and the size of it and the difficulties in making decisions became really one of the issues. I'm not going to go into a lot of detail on here because I want to get to the more interesting part, I hope, for you, which is why reform. And this comes to, I hope, something that you're looking at in your studies as well, is the changing world around the humanitarian action and international NGOs. So for MSF, as being an operational humanitarian organization, since the time of its founding, where the bread and butter of MSF's work were large-scale conflicts, large-scale movements of populations, refugee crises, setting up big refugee camps, etc. Things have been changing quite a bit, and there are new types of conflicts, very complex conflicts with multiple actors, having now migration, climate change, urbanization, many new types of areas of intervention that we weren't really organized to figure out how to. We could do a great big refugee camp, we can come in an epidemic, and we can cross borders when and talk to rebel parties, but if you had a really strong government that wanted to know what you were doing in their backyard, which is normal, actually, and or you have a very different type of situation where populations are not moving to an open space but are living in an urban situation but still need assistance, just weren't organized for that. So again, I already mentioned also this rise of strong states. In the 70s, there were strong states, but as far as being able to cross borders and to carry out activities, there was less of a concern about ensuring that that everyone was informed of what was being done, et cetera. And of course, the decline of the Western dominance in the world as a whole. There's been, we feel, was a change in perception of NGOs, that NGOs used to be seen as charity organizations that were only doing good, and more now being seen as also one of the actors that has a role, whether it's in a conflict or in any kind of situation, and didn't always have just a beneficial role either. And especially for an organization like MSF, which is sometimes known as just coming in and out and not having necessarily a long-term impact, that was sort of seemed less important, more the development agenda, the longer term, especially with the MDGs, et cetera, the longer term development agenda and sustainability became sort of more the buzzwords, whereas MSF's bread and butter was more being there and leaving when no longer needed. The increasing, and I'm going to go quickly here, we can come back if there's time, increasing complexity of medical work. So again, if you talked about in the 70s, you could send any doctor and they would be doing vaccinations, patching up people after a conflict, et cetera. And now the organization has chosen to work in much more complex interventions, such as HIV treatment, second-line treatment. This is something before the year 2000, MSF never treated anyone with HIV. I mean, unless they did it rogue, which a couple people did. It's just really true. They're the ones that started it. But and really never got into anything that would draw the organization into a long-term commitment to patients. So this really changed when there was a decision to actually engage in more complex medical work. I think one of the other interesting changes in the whole field, especially of public health, and this is something Hans works on, is the change in the fields of the global health actors, as we call them, of the rise of really new health actors. And this includes, for example, the Gates Foundation, probably the most influential global health actor, I think, in the world today, probably even could say even stronger than the World Health Organization in many aspects. Also the rise of the Global Fund for HIV, TB, and Malaria, which the U.S. had a big role in, and just really changed the whole landscape for how these diseases were treated. I think another really important, interesting point is the rise of the International Criminal Court and the international justice system, which also changed that notion of the fact that NGOs who are in a place like MSF, who are in a conflict and might be witnessing what is essentially a war crime, in the past they might speak out about it, but the individuals who were perpetrating that would probably have impunity, or unless they were somehow brought to justice within their own country. Now you have an international justice system where you're seeing, particularly African heads or leaders or former heads of different political or military parties being brought into the international justice system. And then NGOs who are on the ground and seeing that actually become no longer just an innocent bystander, but could be seen as actually contributing to the whole international justice system. We've also, over the past years, and this is something I think that you might be interested in talking about in one of your student discussions, is the lack of respect for international humanitarian law, particularly around the targeting of humanitarian workers and medical professionals and facilities in general. MSF has just launched a global campaign around this, as has the International Committee of the Red Cross. Because of the huge rise, and this has been documented. The ICRC has done real documentation on this. Maybe you disagree, I don't know if you've read about this, but on the increases in deliberate attacks on medical personnel and facilities. Of course, the whole information, access to information, which has changed the world in general. On the key external challenges on resources, as the organization grew larger, needed more skilled workers, more people with specific skills, wants to develop national staff, end staff, et cetera, create leadership, the need for increased private income to keep meaning needing to invest in new markets, the rise in lots of international NGOs, so the competition for the resources that do exist is also an issue, and the decision that the organization had made not to seek institutional funding. We also had, and I won't go too much into depth, but we can if you want, but I'm conscious to leave time for questions, because I know a lot of this is really inside MSF. We never use inside baseball because it's a very European organization, but I say inside baseball, so forgive me if it is. But it felt that internally that the organization really needed to have more robust, more frameworks for engagement in the countries they were working, precisely to respond to that more complex settings. So when you have governments who need to be convinced that you are there to really provide independent assistance, you have to have a bit of a coordinated approach. You can't just go in and say, okay, we're here, we're deploying our plane to X airport. You know, I went to the earthquake in Chengdu in 2008 with MSF, and this is really where you could see the difference. They were very used to just sending the plane with this relief supplies when there's a big natural disaster, and knowing that usually the air traffic control will work out a way for things to land. Well, the Chinese government doesn't allow that any way, shape, or form. So they had actually packed, this I shouldn't have put on tape, but they had actually packed a full cargo of relief materials that they were ready, and that costs a lot of money, you know, and you have it on the tarmac ready to go, and could not get permission to land from the other side, but had never even thought, okay, we'll probably have to negotiate, we probably should have had an agreement in place with the Chinese Red Cross ahead of time, so if there's an emergency, we can do it. So this kind of need for a little bit more strategic and organized field management. We also felt that as the organization grew larger, we had a much tougher time speaking out because, for example, if you had multiple MSFs in one country, one section, we say, sorry for the jargon, one, say, Operational Center Belgium or Brussels, feels that they want to speak out about something very strongly. At the same time, OC Paris is negotiating access in a very delicate place that they want to provide assistance in, and don't want OCB to speak at this time, want them to do it later, but later it's too weak. So there became a real slowness in being able to be reactive and speaking out. The need to engage with external actors. The question that Tosca asked me earlier when we were meeting is that MSF is very well known for being extremely independent for all the reasons that I stated in the beginning, but that had sometimes translated into being so independent that there was no engagement with external actors and no dialogue and discussion and work together. We had duplication of support structures, so that if you had 5 MSFs in one country, you may have 5 different offices with different logistics setups, different staff support sections, et cetera. And that we had no international mechanism when these problems arose as to how to resolve the differences within the organization, and that can take a lot of work. The growth I spoke about, $1.2 billion organization in 40 years is a massive growth, and most of that growth had been over the past 10 to 15 years. And if you're in the for-profit business, that's also something that, when you grow to a size like that, you have to have the structures in place to be able to manage it properly. I'm not going to go into this. And there was also a sense that MSF, from its founding, had always been a grouping of individuals together committed to the charter, committed to what we called as a mission, a movement. And that there was always a sense of ownership and accountability and respect for all of the activities within the organization. But that somewhat, as I talked about in the beginning, as the silos had grown and gotten bigger of, MSF France versus MSF Belgium, that internally we were no longer feeling that same, what we like to call co-ownership, that the success of MSF, of any part of MSF, should be supported by the others and should be a source of admiration and pride for the others. One of the other things I didn't talk about on the associative factor of MSF is that, does anyone here know how, I don't know, there might be a couple people who've worked in the field with MSF or who know who make up the association members or the boards of MSF? Or do you want to take a guess? What typically the boards of a nonprofit organization are made up of what type of people?
Old white men.
Sorry?
Old white men.
Old white men with what?
With money.
With money, right? Okay, there's a few white women now too, but definitely are made up of donor-driven boards generally, and northern boards. One very different aspect of MSF from its founding was to have the boards and the associations be made up of a membership that is drawn from former or current field staff. And to have it be as majority medical as possible. And so that this is a real identity issue for MSF, that the people who are making the decisions at the top in the boards have actually come up from the experience of working with the organization in the field, or at least for a fair number of years in the offices, so that they are part of the MSF culture. We have some boards that have 1 or 2 co-opted members who come from, you need a lawyer, you need an accountant, or someone like that. If we can't find them, we co-opt them in. But generally, the boards and the associations are made up of people who work with MSF. And that's a very different type of identity than most of the structures. So there has been a lot of discussion over the history of MSF as to what is the added value of this associative structure. It takes a lot of work to keep people involved. It's like an alumni association, but without the structure of funding in a big university, et cetera, to keep people engaged and relevant in order to be the real guide of the organization. And then, of course, there's also been pressure over the past years. As you saw, I mapped out that the 19 offices of MSF, 14 of them based in Europe, and the others in North America or Asia and Australia, that there really were no voices from the actual areas where the organization was working. They are members. Anybody who is a field person could be a member of MSF, so you could have former national staff who were members. But if you were a national staff in Liberia or Congo, and the once-a-year General Assembly to make decisions on the future directions of the organization was in Paris, and you had to be really good to your head of mission to get a ticket to maybe once in your entire career go to Paris to take part in these discussions. It was really far. Okay? People will argue with me, so this is on tape, but people will argue with me that there were huge efforts made to try to have the debates on the field. We have a yearly field associative debates that feed recommendations that go to the annual General Assemblies of the organization. But still, there's a distance, and so there was a real push, particularly from former national staff or people working in newly formed offices in South Africa or Brazil that were mainly open for other reasons, to try to have an associative space for them to also have a voice in the governance and the direction of MSF that was a meaningful voice, and that their views would also, and there were many like myself that felt that MSF, in order to change and be with the times and address all of these challenges, also really needed to change the face of the organization and really listen to those voices, not just lip service with a trip to Europe every year or so, but to actually have them have a meaningful participation that will help make the organization continue to be relevant going forward. So this questioning of the identity of the organization is nothing new. If any of you have worked before in a Francophone organization or a European, the debate and debate culture is it's something I love in MSF. It's very different from some other organizations that are much more top-down. MSF is really always identifies itself with having this culture of debate, so that before you launch a mission, you have to have a debate within the headquarters. You have a debate on the field about whether the relevance of this project. You have to defend your ideas. You have to listen to new people's ideas. You have to actually fight about it sometimes to convince others that what you want to do is right. And that this actually helps drive MSF to be better, this constant culture of debate and discussion. It's not everybody's cup of tea, and it can be very harsh sometimes, but this is important. So this is not at all the first time that the governance and the identity of the organization had been questioned and debated. There had been basically every 10 years, there had been, and this is something interesting for those of you who are studying international NGOs, it sort of felt like every 10 years there was a cycle where a crisis developed internally. One of the big crises that happened after the Rwandan genocide was between internally within MSF of the sections of MSF that pulled out of the camps out of the camps in Rwanda and those the camps in Congo, and those who didn't. And it caused a huge internal, I'm simplifying it enormously, but huge internal divisions that then only by having a very large process to bring people together to discuss the identity, to reaffirm the principles, and to debate the direction forward was the organization really able to move. So this had happened periodically. So what we launched in 2009 was actually part of a longer process, and I, again, won't go too much into it. But now, for those of you who are studying, and I'm watching the time, those of you who are studying how this actually works, I'm going to kind of go through it quickly and then open for questions, okay, so that you can see, because it can get complicated. So once we started first by everybody saying, we need to change, we need to change, we need to change. And when you hear this enough times, oh, we need to change, we need to change, you're like, okay, let's change, let's figure it out. But the first thing to do then was actually to get agreement in a real sense that we wanted to change. And that's not so easy to do. So the first step was the diagnosis of really not just saying we need to change in an anecdotal sense, but really, you know, doing the research and the discussions needed to agree on a diagnosis. And this was critical, so I'll talk about that in a second. And then to look at the scope. How far did we want to go? What did we want to change? What did we want to leave the same? And doing this at the initial stages, not, you know, in the process, but doing this at the beginning. Agreeing on ambitions for the reforms. Agreeing that if at the end of these reforms we have achieved X, Y, and Z, we will consider it a success, and doing that at the beginning, was really important for this process. And then putting in place an actual process, and this is something that I was charged with as Secretary General. It wasn't, the job that, you sign up for necessarily to be in charge of a large structural change of an international nonprofit, but it's one that is really critical to do, and of course I did not do alone in any way, shape, or form, but it's something that you actually need to put a process in place, decide who's going to be involved, at what stages, when are you going to consult, when are you going to come to decision, and how are you going to come to the decision, and what are the next steps. And then, of course, the implementation is actually happening now. So basically, as I was trying to think about how to present this to you guys, I really think, even if I didn't think of this in the beginning, this is the way it went, and it worked, I believe, is having a sort of a phased, or what you could call a staged approach, where instead of trying to do everything at once, we broke up the process into individual stages where we identified a specific question that we wanted to address. We put in place a process of consultation or research, whichever was needed, and then came up with recommendations that then a decision could be made on. And then we went to the next step. So I will talk. So the very first here, the good example of that was the very first stage. Because there were people who said, we don't need to change. Let's not get bogged down in these bureaucratic discussions of governance. We're here. We're an action organization. We just want to do the work. Everything is fine. We're not wasting any money. We're not having any problems. Let's go. So it really took actually a process of putting everything on paper. So we said, OK, what are the key challenges to the organization that the current structure is not adapted to address? What is working, and what should be preserved, and what should we change? So that internal, external challenges I just went through very, very quickly was actually bringing the directors of operations together, having them, they actually together wrote a paper on what they were seeing as the key challenges to their operations in the field. We had this debated on the field level and bring up questions of things. We did actually a review. This is more of an academic one where we carried out a peer review of all of the different offices of MSF. So because in a large organization, you have a lot of hearsay. So people say, those Swedes, we don't know what they're doing. They're just wasting our money over there in Sweden. We should just close them. I'm going to get in so much trouble where this tape comes out. But this is how it gets, because when you're working really hard in Congo Brazzaville and you hear the Swedes want to send a journal, you're like, what are they doing? And you just don't know. When an organization is that large, you don't know what all the different parts are doing, and therefore the tendency can be to devalue them. So what we did was launch, and it took a lot of work, but I think it was valuable. We did a peer review where we had the different, so the US section reviewed the Australian section, the Australians reviewed the Swedes, et cetera, et cetera. We had people from the field involved. And then we did a review of all of the decision-making platforms, whether it was the medical directors platform, the logistics directors, et cetera, and looked at decision-making within the organization. And when we put this all together after 6 months, and we did this in pretty much 6 months, the agreement was, okay, we really need to change. Because some people really, including myself, were hoping we could just do a few cosmetic things and resolve these problems, but the diagnosis made it clear not. And so this was really essential, is to launch this whole process. You actually had to have agreement and buy-in from everyone. Not every single individual, but for the vast majority, that we needed to do this. Because if you start a process like this without the agreement already that we need to have this process, you're losing, I think, from the get-go. So I felt, I look back and I think this was a critical moment. We agreed on ambitions. I'm not going to go into these because they address mainly those challenges. And then we looked at really what do we want to keep. And here I'll at least mention, the core values of MSF. That action-oriented and the focus on operations, that operations are always at the center, that being able to effectively provide assistance where it's most needed should never be compromised. This was actually the associative governance, what I just mentioned to you, this idea that we are governed by our peers or our former field colleagues, is something that some people were like, that is so archaic and so slow. What does it really bring us? Maybe we should just get rid of that already and be more like the other NGOs that are so efficient. And no, after much discussion, no, wait, it may be messy, it may be, but it really is what keeps MSF, we felt, committed to the core values that are in the charter. We kept independence and diversity of action, and this can be read in many ways, and one of the reasons why we kept this is that, well, I'll get to that in a minute, is not just independence vis-a-vis others, but independence within the organization and having the ability to continue to carry out diverse and independent arms of the organization and operations, to not try to come into a single centralized one, and to maintain that culture of debate and innovation, which sometimes is very time-consuming and hard on people, but we felt that that was valuable. But at the same time, we felt we needed to improve mutual accountability and having a collective vision for certain areas of the organization. We felt we needed to have really robust mechanisms for resolving internal conflicts and for public positioning so that the organization could come out very strongly on a position together. And we wanted to have better associative governance, and we wanted to ensure that we were using our donor funds most efficiently, that we did not have unnecessary duplication of infrastructure. That's the backroom infrastructure in the field. So here, the 5 directors of operations, they came out with the statement that then was agreed by everyone, that any internal reform or change has to be to improve MSF's action in the field and its capacity to respond to the challenges that were outlined. So very operationally focused. So here are the process. I'm pretty much done now. So we agreed on the objectives. We carried out wide consultation. I think the major challenge then is what was the title of my talk, is managing the opinions. Because when you agree to have an associative governance, when you agree to have a wide consultation, and when you agree to have a culture of debate, you get a lot of opinions and ideas. And you have to manage those into a process that actually comes to an agreement at the end. And so one of the major challenges was, and this is why I go back to that structured approach, is having the ability for people to feel that they were heard and that their opinions were heard. They had the forum to make those opinions. And I'm talking about from the field projects. We had the field projects debating these reforms. We had the associations debating them. We had the offices debating them, and tried to put that all into a process and then come up with a few different alternatives of the directions we could go, have those debated, and then everyone, at least for the most part, felt that they'd had an opportunity to have a voice in it. Even if their view was not the one that was ultimately decided on, they know that they had an opportunity. And that was not a perfect process by any means, but I think it's one of the key challenges to managing change in a large international organization of this type. I think one of the big challenges was not letting the process itself overtake the everything else, because a large-scale transformation like this is very boring for most people who come to an organization like MSF. They didn't come to debate governance. They came to provide assistance to people in need. So this is the last thing they want to talk about, even though it's necessary. So you really have to find creative ways for engaging and keeping them engaged without overwhelming it. And believe me, I was known as Mrs. Governance for most of my tenure, and it wasn't my favorite title. But I had no choice. So also, MSF chose to use very minimal resources. This might be very different. I hired 2 consultants, and that's it, 2 people, not 2 firms. And most large organizations have a very, usually have a very robust budget for hiring large consulting firms who help organizations. I know that you might be one who work for one of those, but we chose not to go for that route and to use to do it internally. And ensuring that the process is in sync with the organizational culture. I think this is why I brought up all of that about independence, about the debate, the association, is that you cannot just impose a process on an organization that already has a very well-defined culture. You have to figure out how to get that process in sync with that culture and actually build on it. And so that was one of the key challenges. And then keeping up the momentum. You cannot do a process like this overnight. It took us much longer than we thought, although 3 years is not that bad for something like that. But yet keeping people's interest and momentum is a lot of work. And then my pet peeve is making decisions and then having the new people that came on board that weren't around the year before coming back and coming up with a new idea and disagreeing with the decision that was already taken. So in an organization where debate is encouraged and innovation is encouraged and denouncing everybody is encouraged, that it's sometimes very hard to keep moving. So and communication. I mean, I can't say enough. And one of the reasons, I was charged with heading this is I came from a communications background, and communicating very complex issues that are not everybody's favorite, and stimulating debate and keeping people informed at all levels of the organization is a very tough thing to do. And despite being a communications person, I don't think I did great. Okay, I'm almost done, and then we'll have time. So basically, we put in place a timeline and a methodology. We went phased. We went from the big picture to the narrow structures. We looked at the associative governance first, and then went to the executive, and then actually field governance. And actually ongoing is the layers below that in the executive that are actually reforming now. That process is still ongoing. We put in place a working group, and this was very representative and high level. This was not a working group of just people who might have time on their hands to come up with. These were actually the busiest people in the organization, but they were the absolute key stakeholders also. So having a general director, having an operations director, a medical director at time, a president of key sections, incredibly important. And to having some international leadership. They're from the international president who I worked with myself, and having a minimal external concern. We did not outsource this, and I think that's important. I have nothing against consultants, but it's really about if you outsource a process, it's very hard for that outsourced entity to really understand and be in sync with that organizational culture and ensure the process is. So that was my feeling. I mentioned already we did broad consultation, and we put together some dedicated communications efforts, not enough to really communicate, especially to the field programs about what was happening. That didn't work as well. But then we really set milestones so that there were key meetings where there was no turning back, that a decision had to be made. And if everything had been done, you never wait to a meeting to make a decision. You make sure that you know what, for the most part, that decision is going to be before you get to the meeting. But you have that milestone so that you are working toward that, and you're working with everyone to get the agreement. And then an implementation. So I'll do this in 3 minutes, and I'm going to end. One MSF, these were the key debates. Should we go for one organization, one headquarters, everyone's all aligned, or should we maintain multiple operational centers and have independence of sections? Well, the direction we went with was not the one MSF. This actually became a big debate. This was the first major debate. Many of the field programs, particularly people who were not as experienced within the organization, really wanted to see the organization go to a centralized model and have a one MSF where we'd have, I shouldn't say that one centralized, that they're not experienced, sorry, Michiel. Some very important people who've been in the organization a very long time also felt that there was a reason to go for this centralized model. And I think Tosca and Hans can tell you about other organizations that have gone to that model. They're quite different. We looked at the big decision, was the debate around decision making. So should this be done at an international level? And we make all decisions about who's going to be in what country and operate there, who's getting what money, who gets the investment. Is that done at a central level, an international level, or is that better done by the sections or the operational centers involved? Then again, this idea of which things should we collectively agree on and which should we leave to what we called subsidiarity, the decisions that should be made at the lower levels in order that they're made closer to where the action is. And which decisions should we make together because they'll be more efficient, and which ones do we mind being inefficient but having decisions made that help to ensure that we have the flexibility of action and the continued debate among within that creates innovation and impact. The big debate was, should we grow more? Should we not grow more? Should we open new offices? Should we not? Should we allow associations to open in new areas of the world? Should we allow a Southern Africa association, an East Africa association, a Latin America association? These are all hotly debated. So in June 2011, long story short, we got unanimous agreement on new structures. And structures are only what you make of them, so I know this won't really mean too much to you. But what we agreed to have was an International General Assembly once a year where 2 representatives of every one of the associations plus new associations. We agreed on clear criteria for new associations being allowed into the international movement, which immediately opened East Africa, Southern Africa, Latin America I mentioned, and a couple others that have just been accepted. And that we would once a year have an International General Assembly to set the big lines of the vision of the organization, but then the International General Assembly would leave the international governance to an international board that was made up of the 5 presidents of the 5 operational centers. So you can see already that we kept the centrality of operations and we kept the 5 operational centers, all right, at the core, but that there would now be 6 elected members that had the majority in that international board who were elected from anybody in any of the associations who put themselves forward, and they would be elected by the full International General Assembly. So this is a radical change because the board previously had been the operational centers and a couple of representatives that they, were picked not independent in this manner. So this, and then what, of course, it's you have the board, but what's really important are the statutes that go behind. And what even more important than this was agreeing on which decisions that we would take internationally, how those decisions would be made, who gets to vote and what the voting mechanisms are, and then how they would be enforced. There was huge debates about enforcement. Some sections really wanted to ensure that if a decision was taken and somebody didn't abide by it, there would be consequences for that section. So these were all things that were then laid out in the new statutes. So I can go into lots of detail on them, but we don't have time, and so I think I mentioned the lessons learned already, so I'm going to end it there and hope.
Leave this up because
Yeah.
this is and I was going to ask
mentioned
you,
most.
Can you send me your PowerPoint and
Yeah.
put it up on our updates on our websites?
So I went through most of these already, but I want to make sure we had time for 30 minutes for questions at least.
So,
Question?
are there questions?
Yeah.
Yes.
Did you cost this out in terms of
Yeah.
how this actually operated from I don't know what the cost would mean, but did you kind of?
Yeah, I don't have it offhand. It was done after I left, but I don't have it. But it's very difficult to make the cost because the costs are really in people's time, and all of the discussions and debates that were had throughout the organization took time from everybody, and that's very difficult to cost out. The actual monetary cost of the meetings and the consultants and my time, et cetera, is pretty minimal compared to what I think the actual cost for the organization is. So that's not a clear answer, but
Did you track the time spent though in terms of staff time?
Not fully, no. No.
That wasn't a mistake?
Probably it would have been good, but might have spent a lot of time on tracking something that I don't know how useful it is to look at afterwards. I don't know.
Did you have measures before in terms of comparing the after and the before?
We had the clear ambitions marked out, yeah, and
No, I'm talking about service measures.
No.
In terms of the results of the structure.
you mean the cost?
No, I'm talking about the total impact of this associations in delivering what they're supposed to deliver.
Well, that's ongoing now. I mean, it's implementing now. So, yeah, I mean, we have the challenges that we wanted to see if we could improve upon. But we didn't do it in a kind of, and I hate to say it, but in an academic way of having all of the matrices set out and being able to cost them out, et cetera.
And
No.
you're 2 years into implementation, right?
Yeah.
Yeah. Okay, let's have some
So,
other questions.
no. So other questions? Sorry, you can ask about other things in MSF too. I mean, I addressed the governance reform because it's what Tosca and I talked about, but I know there are other issues that might interest you as well.
Yeah, so who has the final decision?
It depends what decision is being made, all right? And this is really a good question because what was agreed is that for operational decisions, so for example, for who will intervene in any country, that the operational directorate, so those 5 OCs, they have independent decision making. If they decide that they want to go into a country and open operations, that's their decision. How they organize their operations, that's their decision. The only time that it would come to the international board to make a decision would be in the case of a conflict or a security issue, where one section is challenging another, that if they came into a country and started to operate, it could put another program in jeopardy, or could compromise the security of staff or something they were doing. So what we kept is a very decentralized approach to operation, and tried to have the international decisions be focused more on the resources, security, speaking out, and the structural support to the organization. So that we were being, because we really felt that having the 5 operational centers, having that capacity of engagement and initiative was very important for remaining effective on the field and keeping the capacity of the organization. And yet we wanted to reduce the waste that comes from the duplications. So things like, we put in place a global investment policy. We're putting in place global policies on human resources and salaries, for example, so that there's not competition within a country on the same salaries and things like that. So we've chosen which decisions should be made where.
So does that mean that, for example, 2 of your operational centers or 2 or more can decide to move into an area without...
I mean, they're supposed to talk and discuss it, and usually they do. I mean, it's not a free-for-all in that sense. There are platforms, there are operational directors' platforms. Every country has a coordinating mechanism if there's more than one section there, so they should be, but they don't have to. So if, for example, one section has gone and done an assessment in an area of the country and said there are no needs there, we didn't get any, we don't think that MSF needs to intervene. If another operational center says, well, we're getting indicators from our sources to say that the nutritional situation is actually much worse in this pocket, so we're going to go check it out ourselves. They can go do that. And if they want to start operations, they can.
Mark, you had a question?
In your earlier slides, you showed a breakdown of the different sources of revenue, and also how much you spend on program costs and then like overhead. And then you mentioned how some organizations that say they spend 99% on program cares alone, you should be suspicious of that. So it makes you think back to a discussion we had in class about overhead and how NGOs are pressured into keep their overhead low, especially for the charity navigator.
Yeah, really important.
I noticed that over 90% of donations come from individuals, I believe, from
Yeah.
the U.S. branch. So I was wondering, when you're trying to do these these large structural changes, you mentioned investment in HR and salaries, and how you try to invest in the overhead in order to help then expand your operation and make it more efficient in the long run. Do you feel sometimes pressured because of organizations like Charity Navigator? Maybe they put too much
definitely.
pressure on overhead, even though it will make it more efficient in the long run. And
yeah, I mean, I think there should be pressure on overhead. I mean, I think things like Charity Navigator here in the United States and those watchdogs are really good for especially if they have people on the board like you who will look at.
No, I was going to say, your opinion is not shared
I
with
know.
some of your U.S.
I know that.
colleagues.
I know that, but it's the way it's done that's really important. And what I mention is, I mean, there are very few, obviously if an organization is saying they're putting 99% on the field, you know that there's some issue. And so, but if they're saying that they're putting, 95%, then you at least want to see where they get, if their funds are all big government grants and they have, 2 people who are administering those grants, they're much less costly than an organization that has a lot of individual or private donations to gain those funds. They have other costs, but it's different. And that, I think, Charity Navigator should look at more clearly than just putting everybody in the same metrics, because it's very different.
Although to be fair to your data, I think it said that 90% of your funding comes from individuals, corporations and foundations.
Corporations is like
combined.
Nothing.
So the individuals were not separated out within that group.
No, but
it's still
foundations are, in the United States especially, foundations are a lot of them are large family foundations anyway, so.
if there was like a spotlight on overhead, does that make it, I guess, more difficult in a way than those who do seek out government grants when you are looking to, spend money in these fundraisers?
I think sometimes it makes people, I mean, donors are very savvy, I think, and donors, especially in all countries where we're raising funds, they might have different things they look at Some things might be CEO pay. In the UK right now, CEO pay is a major issue among nonprofits. Others are accountability and accounting, but in the US it's very much about that percentage, I think. So I do think there's an overemphasis on that, and that sometimes it's hard to explain that to people, and that it's actually a choice that's made for operational reasons.
Yeah, and in fairness to charity navigate, they are actually changing.
I heard that.
The basis for calculating the ratings is by far no longer as much based in overhead program ratios. Julia, Topsy, and Maggie, all from my class. I'm so proud.
Oh, that's nice.
So you had mentioned communication being critical, and especially in the diagnosis phase, and making sure everybody understands the need for change. Also on the implementation side, that's so critical. And I'm just curious how effective you feel it's been on the implementation side, where things stand today, or like what challenges that you came across in implementing.
Well, I think what comes, the big thing in communication is just such a large organization with so many different layers, and with an intention to really not just have a top-down decision. You know, that's what, if you say, okay, this is the body that's going to make the decision and everybody has to fall in line. If you did that right at the beginning, and in some organizations that would be fine. In MSF you'd have had a revolt, you know, and I had a couple revolts, you know, which just made total sense, but they were all because there hadn't been appropriate communication. So some of the field staff, for example, understood this one MSF as turning MSF into one singular organization, when in fact the people who were calling for one MSF had a more nuanced approach, so it turned into an internal debate that was just based on miscommunication, but took a lot of time and burned a lot of passion. So I really regret not putting in place a more robust communication mechanism from the beginning, and really looking at how we should address that. And I think that was a lesson learned, especially as a communications person. I'm kind of embarrassed that it wasn't better. And now for implementation, actually I think implementation, people were so relieved to have the process over, and they were really excited about these new structures. These have been, I mean, one of the things that I think was really lesson learned is really you got to mark those key changes with a big, you know, people have to see them, they have to be visible. So when we established the first International General Assembly in Paris, we did it in Paris on the 40th anniversary of the founding of the organization. We used it as an occasion to educate everybody on the changes and what they would mean. We had, you know, and what the implementation plan would be going forward. And so I think that really helped, because the field people were involved in that, the former association, the association members. There was voting for new, I mean, we brought in, you know, we already had South Africa brought in, East Africa. There was immediate change at the, you know, you saw it. There were different people at the table. It just, wow, I was in tears, honestly, because I was tired, but also it was an actual, you know, it was a visible change, and that makes a huge difference for implementation. So it's not just bureaucratic, it's there.
The same thing that we know from other change processes in INGOs, that the implementation phase itself brings up wholly unforeseen challenges.
My successor is dealing.
And your successor is the one who's
No, and it's ongoing. I mean, and also, we put in place a process because we wanted to have a beginning and an end, because you didn't want the process to take over. But governance, I think, is something, if I learn anything, it's got to be constantly, you know, constantly addressed and tweaked and looked into. It's not something that's just one process.
Topsy. Yeah, kind of going back to the question on who makes the decisions, and you said, you know, the operational heads kind of take charge of that aspect. But the security issues, for example, go higher up, right? So I'm just wondering, how do you, given that a lot of situations currently in the international intervention space are overlap tremendously. So whether you're talking about, you know, access to food resources or water and sanitation or climate change, they can be linked to security issues.
Totally.
In many ways. So how do your operation directors kind of deal with stuff where, you know, perhaps more often than not, you are dealing with security either directly or indirectly?
No, but I think that's a really great point, and it speaks to one of the challenges that you know, was addressed at the very beginning, that, you know, you can't just you can't partition these different issues anymore. They can all have impact on each other, and with the rapid flow of information now, you can't just be saying one thing to one leader one place and doing something else someplace else, and, you know, and they won't find out about it. Everything overlaps. So, so the idea is really to have a more robust, you know, operational directors platforms, and of course the country. It's complicated in MSF, but how the different, if there's more than one section, they have rules of engagement. More than one section in a conflict or in a region, that they need to discuss and define those rules of engagement. And if something isn't working, it will go up. And then what is different is that now the International Board can make that decision and actually say, okay, either everybody's pulling out, or one section is pulling out, or we need to define on paper rules of engagement, et cetera. So that's, and security is first and foremost. I mean, some of you may know that in the last months, MSF was unfortunately forced to withdraw from Somalia after working in the country for many, many years and with huge needs in the country. But because of the inability to ensure the security of staff any longer, they really felt that it was time to pull out. And that was the decision that took huge amounts of debate, and was a very difficult decision to take.
Very emotional, I imagine.
Very emotional, yeah.
Did they consider going underground?
How do you mean?
Well, there's two meanings that I mean. One is going underground in terms of within the society, but also going underground in terms of safety, requiring all people who are to be served to go to underground locations that are easier to secure.
Hard to do that in the scale that of the needs.
To do that, but it's not impossible.
Maggie?
Yeah, to return to Julia's point,
Yeah.
I too come from a communications background.
Yeah.
So we talked a little bit about sort of the debate on what to change in the
Yeah.
implementation
Yeah.
communication structure, but with such a decentralized organization, with the multiple layers you were talking about, what changes were made to sort of the internal communication structure to make it more effective?
That's a really good question, and that's, I think, still not perfect. Nothing is perfect ever, but. So basically, by taking the staged approach, so we looked at the top structures first, and then they then are being somewhat replicated for the different types of platforms. So for the communications directors, the operations directors, but it's being done in a pragmatic way, so based on. So operations director is very specific on the decisions that they need to make. Medical directors the same on the medical policies. Communications directors never have a final say on the message. It's always going to be operations that will drive that message and improve it. But you still want to have a good rules of engagement of how you share information ahead of time, how you ensure that all the organization gets around a specific message at one time to have the biggest impact, how to make sure that there's not conflicting positions being put out at the same time. So basically on communications, it was agreed to, again, not have a one voice approach, to try to improve so that decisions could be made at an international level, to try to have a one voice when necessary, like on the Somalia pullout, like on the lack of ability to achieve access in Syria and things like that. But that there was still the ability for a operational section to speak out on their own if they felt it was necessary, even if it was in opposition to another arm of the organization. So we kept that same view of operational independence on communications. Now, this is not something that everyone agrees with fully, but that's the way it was agreed to. And it's the International Board that could come out with the majority position if necessary.
So does that mean that you might have multiple
Yes.
spokespeople in each
Yes.
country when needed?
Well, a lot of times you want to because you need it.
Different languages
Yeah, you
target
need it.
audience.
But hopefully they're staying on message is what you're talking about
Yeah.
more. What we might have, and you'll see it sometimes with MSF, is actually a different messages. It should be only in extreme cases, but again, because we did not go for that centralized one operations, and since the message is linked with the operations, if you might have different operational visions in the same country, you may have a different view. And this comes from the history. This is why I'm sorry I was long-winded, but going back to the history, when the conflicts within the organization have not just been about, oh, you got there and took that. They've been on principled issues of humanitarian action and independence. Okay, there have been some petty ones too, but the big ones have really been around the principles, and the organization really feels that they have grown from that and learned from that, and that is important to maintain.
Actually, right from that starting point, I'm wondering if you could comment on how MSF is coping with pressure to collaborate with other NGOs, or how, whether it's the issue of protection or the issue of, you've made some very different changes as you were noting on how to reform the organization. So most of the big NGOs have gone through this.
Yeah, everybody's doing it now. Yeah, everybody.
Yeah. And so, philosophically, we can see that, between development and humanitarian action, there can be some conflict in and of itself at times. So how does your new structure help you or create new challenges for governing in a sort of more collaborative or network?
Yeah, we were just talking about this before. So as I said, one of the issues that was identified as a challenge was the fact that by maintaining the choice of independence, particularly in the humanitarian sphere, where with the cluster system of the UN and I don't know how many people are very aware, I guess, of
there's been a lot of pressure from the UN, for instance, on
to align all, that you have a goal of peace in a country and that you align all of the different actors to achieve that. And for MSF, humanitarian action needs to be independent of any political process and even a peace prize. Even though MSF won the Nobel Peace Prize, it's still, it was a little misnomer, but is to stay independent of those. And yet at the same time recognizing that if MSF would also like to have an influence on the humanitarian agenda and on those discussions and to have high-level engagement with states and regional bodies, had to be organized better to do that, to have a specific position and to have the mechanisms in place to do that. So, for example, so we did. We put a new humanitarian advocacy a group together. So we have a single representative to the United Nations in New York. We have one for the ASEAN region. We have one in Addis Ababa for the African Union, and so that is all very, very new. And that agenda is made internationally and agreed upon, so that at least we can have some coherent positioning vis-a-vis other bodies. And then we've worked very closely with the International Committee of the Red Cross now on a number of issues, and have started to re-engage with some of the coordinating bodies of both the UN system as well as the humanitarian system. So, and that's a conscious choice. I don't know if it's going to work, and MSF will definitely maintain its independence for all the reasons that I mentioned, but hopefully more collaboration.
I have a question. Let me just check. Anybody else have some last questions? Right, let me ask and then I'll have you let the last word. My question is around dual citizenship. So it's, given that, and I'll explain what I mean. I think we probably use something similar to that. So MSF being, as Meg was saying, still very decentralized and based on associative governance. If I look at a federated organization like ActionAid, and even at Oxfam as a confederation, there's a lot of talk about dual citizenship, by which they mean how can we get to a situation where both staff and leaders in these relatively loose organizations feel an obligation both to what the national associate they're a member of, and to the global structure, and that they constantly try to balance their responsibilities. Is that an issue at all?
It's a huge issue. I mean, that's where this mutual accountability, we use a different buzzword about it, really, is that that's what the international board, one of their main functions is to drive the mutual accountability, so that that the actions taken by one arm of the organization are well understood and agreed upon by the others, even if they don't have a say over it, that we feel co-ownership over everything. So, but it's really hard because, of course, I mean, even if you look at on the field level, if you're in a mission with one section, you're on one mission, you're doing a nutrition project, even someone within your own section might be doing an HIV program down the lane, and you're focused on your project, and it's great. It's hard to say, oh, but how come they're getting more resources over there for HIV? We need it for this. It's very hard to break that down at a local level, even internationally. So, but it is definitely one of the goals, and it will be one of the biggest challenges, I think. But this is why we wanted to maintain the independence, wanted to maintain the associative spirit, because the identity within MSF to identify with your colleagues, even across sections, is still there, no question.
Ryan, last question.
It's kind of related to this. When you had that first huge debate about one MSF versus the associative structure.
Yeah. Painful.
I
was remembering when I was like, oh my God.
So in that debate, so I'm sure the operation centers, the operation countries were very much on the side of we should not make it one MSF.
Yeah.
Was that a divide between the operation centers and everyone else, or did everyone else?
It's a really good question. It was much more nuanced than that. In some ways, it was used to, some people really, I think, instigated the debate because they wanted to push things far. They knew it wouldn't go that far, but by actually calling into question, for example, the fact that MSF France might have to merge with MSF Belgium. It's like, you can't imagine what that, could cause. To you, it might seem like, yeah, that seems normal. They're very close, whatever. But, it's like, you're kidding. That would be just enormous. So yeah, in some ways, it was made to push the envelope. But then there were others who actually really believed that might be the best way forward. And actually some of them, I was incorrect before, a couple of them were people who actually had long-term engagement with the organization and thought that the benefits that we were getting by having the multiple centers were less than the benefits we could gain by having a more centralized approach and service and support structures. And many of the partner sections, of course, what we used to call partner sections, I'm still using the old lingo, the support sections like MSF USA, which provides around 20% of the organization's funding globally, has a say on everything, basically, right? And they, of course, don't want to see their donors' money wasted by having 5 offices in Nairobi. So they're like, come on, So there are many people who, from that perspective, also thought it'd be more efficient to have it. But I think it was a really strong debate, but it was one that was much more nuanced than just operations versus non. Because again, when you have the decisions and the debate being had by the people who actually had been in the field, they could also see, that in some countries where it was beneficial to have more than one operational section, and that, for example, and also, the Haiti earthquake happened in the middle of this reform process, which is something I should mention. And MSF has a long history in Haiti, but actually had been starting to close down some programs right before. Having most of the time on natural disasters, we happened to be there already. It became an enormous response for the organization because there were so many people, and the response then to the cholera outbreak that happened, which is now in the news again. MSF treated, by far the largest majority of the patients there, despite all the other organizations there. And so the only way that it was seen that the organization was able to have that capacity was actually by having the different sections, the different operational lines that were able to manage that much capacity. So in some ways, the argument was happening at the same time as we were showing the reasons why we might want to maintain this diversity. So it's interesting, yeah.
Well, we have to bring it to a close also because ICT needs to set up their recording equipment for their recording interviews in the same space at 3:30. So if you want to ask one or two one-on-one questions, you can do it in this space. Just let me ask on behalf of ICT, they ask me if to do it in one form so they can move these tables out and set themselves up. Thank you so much.
Thank you very much, everybody. Great questions. Thank you. Thanks for your questions. Sorry, I don't have